My grandma, she had dementia. She had a 24/7 caregiver. One day we found out there was a lot of blue marks on my grandma, and we decided to put a hidden camera. And then we decided to put a hidden camera and found out that she also got abused. And Romy thought there's something the technology can do here.
Nevo, thank you so much for hopping on today's podcast. Excited to speak to you today and learn about the interesting work you guys are doing with senior care at Sensi.AI. You and your co-founders, I believe there's two others, all came from Israel's vibrant startup scene. What led you guys to start Sensi and why senior care?
Yeah, so first of all, thank you for having me, Bert. Really pleasure. So yeah, I think the CEO of the company, Romy, and we went to university together. We both software engineering by training. So we did all the tasks and prepared for exams. So we work really good together, and we're good friends. Along the years, each one of us came with his personal story, where Romy put her her daughter in a kindergarten, and after a couple of days, they noticed something was wrong with her behavior. They decided to pull her out of the kindergarten. After a while, they discovered that the team there really abused the kids. Unfortunately, it's something that happens a lot in the last few years in Israel. And the way they found out was that a parent in the same kindergarten just put an audio recording in his daughter's backpack. My personal story is that my grandma, she had dementia, and she had a 24/7 caregiver. And one day we found out there was a lot of blue marks on my grandma, and we decided to put a hidden camera. Obviously, my grandma couldn't tell us if something was wrong. She didn't remember us. She wasn't making any sense. And then we decided to put a hidden camera and found out that she also got abused. And me and Romy, we met for to catch up, just a beer after work, and we're telling each other the stories. And Romy thought there's something the technology can do here. When we first tackled this area, we realized that there's a very worrying trend around the world of aging. Obviously, the population of 65 plus is getting bigger and bigger, and there aren't a lot of caregivers around the world. So there's a very stressing trend there, and that's when we actually decided to go with this idea and start with Sensi. Yeah, so that's the story of how everything started.
I mean, those are both very powerful, personal stories from you and Romy, your CEO co-founder. And you guys have, basically came to this conclusion that there's a market for putting technology in the home of seniors, but informed by the experiences you had with your grandma and she had with her, child in kindergarten. So can you tell me a little bit about some of the now that you guys have focused on, I believe, the U.S. market, right, with senior care? What are the biggest challenges that you guys are seeing in home care today, both for seniors trying to age safely at the home, and then also we've spoken about the agencies and the groups that try to serve them?
Yeah. So I think that for the seniors, I would say that access a consistent quality care is one of the most challenging things that they have right now because of the caregiver shortage, especially in rural and underserved areas. They experience a lot of gaps and struggle. Keep in mind that seniors, their condition is as they age, their condition is keep changing all the time. And you need someone there to look at the bigger picture, to understand their needs, to understand what changed, to understand what's going on the day to day, to understand what care they need to get, how to change the care plan, what kind of care. Right. That things will lead to cognitive, physical challenges, which will result in falls, medication errors, difficulty with mobility, and those kind of risks. So I think that's the biggest challenge that seniors are challenging and are facing right now. And then you have the financial resources, which is also a huge issue. You have today in the US, you have Medicare, Medicaid. It doesn't cover everything. They still need to get money out of their pocket. It brings a lot of stress both to the family that needs to look after them, if they have family, or
Mm-hmm.
to themselves. And the solutions today are not
Mm-hmm.
cheap. Yeah, I would say that's the second biggest thing. I think that eventually, and that's, we hear it a lot from our customers, home care agencies. They say that 85% of the seniors are not getting the amount of hours they should get, and that leads to social isolation, loneliness, home safety challenges, fall risks, and then eventually to hospital, or even worse. So I would say these are the biggest two challenges that seniors are facing today. And if we look at the home care agencies, so I would say that caregiver retention is the hardest challenge that they're facing today. They have a high turnover of caregivers. The caregivers work a lot. They're being burnout from the amount of hours and the conditions that they're facing, which makes them, change or look all the time for different agencies or different income. Um, I would say that they need to recruit these
Right.
caregivers. They need to train them. They need to monitor them. They need, I mean, and all of that is it's a huge burden for the home care agencies. Other than that, I think that they also struggling with financial costs because they need to balance between what they need to pay for the caregiver, and we can see like over the years that the minimum wage is just going up and up, and then the seniors that can't afford a lot of care, so they need to balance these two things and still make money because it's a business
Mm-hmm.
eventually. And third, I would say I think that they are very heavy, sorry, on operation and technology integration. It's hard for them to adopt technology. They're so busy with looking after the seniors and hiring the caregivers and to make sure that everything is okay, and the shifts, the scheduling, the billing, everything together. It's a huge
Yeah.
challenge for them to run this business. So yeah, I would say these things just
Yeah. I
come
mean,
to
I think you hit
mind.
it right on the nail for the senior population and the home care agencies. For seniors, like access to consistent quality care. Their conditions change over time, like you said. That's spot on. Financial resources, like Medicare and Medicaid, unfortunately, it doesn't cover everything, and then it puts a stress on them or their families. And then that number is really impressive, like, or just it stands out that 85% of them aren't getting the amount of hours they should get. That you're learning from your home care customers, which, like you said, are deal with their myriad of challenges at the moment, and like tech integration is like, man, they have to do all this, and then finding time to do tech integrations and establishing technology seems like a drain on them. Similar to practices like physician practices. Any tech adoption initiative feels like it's like an ocean to cross. But walk us through how like your technology at Sensi actually works at Sensi.AI, and what kind of outcomes you guys
Yeah,
are
of
seeing
course,
for those seniors and agencies.
absolutely. So Sensi basically, for those who never heard of us, is like an always-on virtual care assistant that it designed to help seniors to age safely and independently at home, in their own home, in their natural environment where they want to be, and it's without compromising any of their privacy. So it uses audio advanced technology to detect care-related issues like I mentioned earlier, like the falls, skip medications, confusion, distress. When something goes wrong, then it alerts in real time to the care team, which will allow them to step in, make the changes, and improve the outcomes, the care outcomes of that senior. That's like really high level. So at the end of the day, you have like little pods. They're passive, plug and play solution that you just go. The integration is very minimal. You just go in a home, you plug it in, and that's it. No, nothing else is necessary. We can detect the events in real time, things to do with their clinical condition. So you can think of, we can detect early signs of dementia or early signs of UTI, urine infection, early signs of pneumonia, these kind of things, and alert the team. We can also, another vertical of our solutions is to point out any changes in the care that
Mm,
he's getting. So was the care plan executed properly? Is the senior happy with the care that he's getting? Is the caregiver lacking any kind of qualifications? If he does, then we can detect it, and we can also suggest like the right content that they will get in order to improve their abilities, skills, eventually affect the senior and the family. And the third vertical that we're offering is high level alert. So any case of fall, call for help, EMS, those kind of things, the system can detect it straight away and trigger real time alert for someone that will come and be able to help in that case. We're also offering, I mentioned, like training content, so they can train their caregivers. We're partnering with Tipa Snow. She's well known in the dementia area, and we offer also reports that they can take into their team to improve the team, the home care agency team, but also reports that they can take to the families and deliver a message about the changing condition of the
interesting.
senior.
So, yeah, you guys have
Um,
really built a solution that takes
yeah.
into account not just the seniors' needs, but also the home care agencies that treat the seniors. You know, because like you said, there's part of it that
Hmm.
like the text says the care plan been executed. You know, is do you have the right training content to train your caregivers? Because like you said earlier, there's so much like retention and turnover issues that I'm sure they're cycling through caregivers all the time. So it's like they want to provide a consistent level of
Yeah.
care, and the seniors that are paying for it expect that. You know, so. And you said it uses advanced audio. Like, does it also have visual components, like the whole camera story that we were talking about earlier, like those two stories, like, or is it just audio based? You know?
It is just audio based because of privacy. Keep in mind that a lot of the sensitive situations happens in the
Mm,
bathroom, the shower. It's not going to be
yeah,
comfortable
absolutely.
for anyone. And the thing is that audio contains so much information, so much data. Then you can, if I'll take you now and put you in a room and just cover your eyes, you probably would be able to explain like 95% of what's going
Yeah,
on in the environment. So we're really respecting privacy of people. We're only focusing on care and what is care related. So that's a good balance between enough data and the
yeah,
privacy
yeah.
of the
Right on.
senior.
Yeah, no, I'm sure that picks up a lot of data on in the home of seniors. And you guys provide these. You called them pods earlier, like the home care agencies receive these pods ahead of time that they can plug and play into the home of seniors.
Exactly. Yeah, so they're getting kits. We're taking care of everything. We're not relying on the seniors' internet at home. We're not relying on anything.
Wow.
It's like it's a kit that contains everything. Just go into the house, you plug in everything to the
How does
electricity,
it,
and
so
that's
without
it.
Wi-Fi, how does it work without internet? Like through?
So we provide everything. We
Oh, I see.
provide the
Okay,
network. We provide
very
everything.
interesting. Wow. Okay.
Yeah,
You guys are almost like the
yeah.
Geek
It's
Squad, like if you know with the Best Buy model, but of senior care in the home of seniors. You know.
yeah, kind of. I mean, we know that a lot of seniors they don't have a lot of
Right.
technology at home. Many of them doesn't even have like internet at home, so we can't rely on that. And we want to offer everyone our solution. So we will take care of everything. All they need to do is to plug it in,
Yeah.
and that's it. We don't require any, for the senior to come and talk or to do any kind of installation. Nothing.
Easy
Just
install. Yeah.
plug and play.
I love that.
Exactly. It just reduces
How many like
the
in
friction.
states is the Sensi like AI kits in out of the top of your mind? Yeah.
Yeah, so we operate today in Canada and the
Okay.
US mainly. We also operate in Israel, but that's just for like for the company employees, investors. So we offering Sensi
Yeah.
as a gift. Today in the US, I believe we're already located in almost 45 or 46 states, and in Canada,
Their
almost
provinces. Yeah.
yeah. So it's pretty, yeah, we're
Yeah,
pretty
no, that's
spread there.
awesome. That's already a huge net of, in the home of many seniors across 46 states and in Canada and even in Israel. So that's impressive. Now, this technology makes a lot of sense to
Yeah.
me. It makes a lot of sense to you. What are like the biggest reasons, like, and you started to touch on this earlier, but what are the biggest reasons like agencies and other technology partners or other home care providers, let's say, like hesitate to adopt something like Sensi.AI, and like what's helped you guys shift that mindset?
Yeah. So I think that the first thing will be to bring better service, better care for the seniors, because they're struggling to bring caregivers, to hire caregivers, and the turnaround is very big. I'm quoting like
Yeah,
some of our
crazy.
customers. They're just taking people out from the streets, sending them to a home, and pray that everything will be okay. So it gives them some kind of visualization into the homes. They understand where are the gaps, where are what changes need to be done in the seniors day to day in this care plan, what changes need to be executed with the caregiver, and then it gives them a lot of knowledge and to be able to provide eventually like better service, better care for the seniors. We can see it with the satisfaction of the seniors and the family. We can see it also in the time that the seniors stay with the home care agency,
Mm,
right? Because we were able to prove that seniors with Sensi will last 8 months more with the home care agency than seniors without Sensi. Why? Because we bring the early detection. We're able to point out things before they're escalated, and those seniors will get to a hospital or even worse. So we're managing to keep them at home to prevent diseases, conditions, and then they stay longer with the home care agency, which then brings to the home care agencies. I think that another major thing is that there's a huge competition in this area. So if you just point out any location in the home in the US, you'll see there's a lot of home care agencies around them, and they're battling
yeah,
for seniors. And for home care agencies that work with Sensi, they have a leverage, they have technology, they have AI, and they can sell themselves better and get more traffic and more clients eventually. I think the third one, the third thing, the third reason is just like I said, that caregiver retention. So it will allow them to keep the caregiver more happy, because there's no he said, she said, the family said that, the caregiver said that. Like this source of
yeah,
truth called sensing, right? So it enables them to provide more tools to the caregivers. By doing that, they will retain
yeah.
them better and
Yeah,
for
spot
longer.
on. You know what? I love what you said when it's like it gives them like a visualization of the home. Like for example, like where are the care gaps in the care plan? Because like if you think about it, that's how like that's the level of healthcare you expect when you go to like a hospital or a larger facility in the U.S. Right? Like you're and the usually the attending physician right will review all of your notes and your history prior to coming to see you at an appointment. And it's like, can we provide that level of service in the home with home care agencies where before their caregivers are going into the home of seniors, they're able to visualize that home. Okay, this senior has had this care plan for X amount of time, has seen these caregivers in the last 6-12 months, this is, and then I'm sure there's notes in the system and other data that's been collected, right? So I love when you said that. It really like enables these agencies and their staff that's constantly changing. And then the second thing is this data point you called out around like seniors with Sensi last 8 months more with home care agencies than those that don't have Sensi. Like that's an impressive stat, and it's a testament to what you
Yeah,
guys are building over there.
yeah, absolutely. One thing that maybe I mentioned, I forgot to mention, is that we also take in the contextual data of the senior. So we're able to integrate to systems that hold this data, bring the data on the seniors, so we know the history, know what kind of conditions he had, what kind of medicines he's taking, and we're able to integrate it into our data, which is what actually happens in the home, and then to come
Mm.
out with better insights and better
That's what you
outcomes
mean
for
by
the seniors.
contextualize the data, like with like the senior's existing data plus the data you're collecting.
Exactly,
Now,
exactly.
part of the literally the name of your business is Sensi.AI, right? And you are expanding fast and launching, from what I understand, a new line of AI agents. Can you tell us what's next there with these AI agents?
The agentic era in a sense is fascinating right now. Other than what happens outside that everyone is using now, LLMs and agents, we have so much data that we can use in order to provide our customers, the home care agencies, better tools to run their business. So it's either for getting more business. So we have agents that will be able to contact like people who will need some kind of care, and then to bring them as leads to the home care agency. We also can help them with operational tasks that they have on the day to day. You can think of scheduling, you can think of changing the care plan, and everything based on data. And it's you have so much data today that it's really hard for a person, and it will take a lot of time for a person to digest all this data and to come up with a solution where our agents are able to do it very quick. They don't sleep. They can get all the data from all the sources and make a decision and offer it to the care managers in the
Yeah.
home care agency. So it's both on the operational side, it's both on growth. We want to help our home care agencies to grow and to bring them
Mm.
more business. And obviously, on top of Sensi data, there's so much you can do to bring better outcomes for the senior and his satisfaction
Yeah, yeah,
on
right
that
on.
side. Yeah.
I mean, you guys are again like these AI agents sounds like it's again going back to serving the home care agencies that serve the seniors, right? Because they not just have to provide caregivers, but there's all this other operational stuff that goes on with them with scheduling, care plans changing, and like when you earlier you were talking about like making integration as easy as possible. Are these agents like, I know it's probably still being built out, but I'm curious, like, is that going to live in their existing softwares that like agencies use, like HHX exchanges, I think is a big one in the space? Will that end up working directly with those type of softwares?
Yeah, of course. So AMS as the agency management system is something that we're integrating with, and we're able to understand what's going on and then try to push them like tasks, notifications, like data basically to their existing software where they already run their business, and they're managing to get everything
Yeah,
in one place and to work with it and make decisions faster and bring better results
that's
to
amazing.
the seniors. So we do integration into these systems. We're doing everything that we can to make their lives much
Yeah,
easier, their operational tasks faster, and to have all the data they need
yep,
in one place.
yeah, that's fascinating. I mean, you've seen that in the acute side of healthcare by like high acuity, like with hospitals and clinics with their EHR systems that they use, like big ones. Like a lot of tech companies out there have been able to like build integrations or agents directly into their EHR and workflows. And that's really the sweet spot for them, right? Because like you as a home care agency owner, like you don't want to have to like log into a bunch of different portals and like access like different logins to get to the same objective. It's like if you have one place that you could do it all in, it makes your life easier and easier for your eventually your staff and the care you deliver.
Yeah, and the home care agencies employees, the care manager, they're very busy. They really struggle just to lift their heads from the day to day. They need to do the scheduling and the billing and the hiring and the marketing and everything like, and to go visit the senior. Sometimes you have regulation around it, and they are a bit tired of having a lot of technologies, being offered so many technologies that unfortunately the majority are just not working for them. So they're struggling with everything, and we're trying to see like how we can take all those pain points into one solution that will make their
Right, right.
lives easier. And I believe that we can see that home care agencies that are using Sensi are able to grow
Mm-hmm.
faster, and that their employees are much happier because they have more tools to manage many seniors, and the feedback that they're getting from the families and the seniors
Yeah.
are also
Wow,
amazing.
that's well said. I mean, you guys are really thinking about what is their current tech stack look like and how do we make it as easy as possible to plug into that and help them grow it. It's not just like make it easy to start. It's like, okay, make sure that actually the technology is helps with my long-term growth as an agency serving a bunch of seniors.
Yeah, precisely. But not only that, we're trying to look at the entire journey of the senior. I mean,
Mm,
home care agency will provide services, I would say, a very significant but partial part of the senior's life
mm,
journey, aging journey. And we're trying to see like where we can be during the entire journey. So even before he will get physical care, we'll be able to be there to provide 24/7 safety net for that senior, and to point into the specific times where the condition changes and he needs a different
Yeah. Yeah,
care.
at that point, it's maybe working with different post-acute provider groups, or even like the hospitals that discharged from, or better yet, or facilities and retirement communities where seniors have transitioned out of and are ready to go into the home, or their family has made that decision. Like all those are,
Yeah,
there's different, like I don't think there's a one size fits all model, right, with this journey, because every journey for a senior to age in place or age in the home is much different. They all come from different parts of the healthcare system. So it sounds like you guys are thinking about that, right?
yeah.
And really, what's that journey look like?
Yeah, and you touched a really good point, because those institutions will refer seniors to home care agencies that are using AI and are using advanced tools in order to provide better service because they know that if they're going to refer them to someone who's not using, like, that doesn't have the right tools, then probably the senior will come back to the hospital or will come back, and it's not
Yeah.
good for them.
Yeah.
Some of them will get fined for that. So they will prefer to refer them to home care agencies that utilize AI and have the right tools. So the seniors will stay longer in
Right.
their
Right. Spot
homes.
on. And, for the seniors out there, their families, the home care agencies, as well as other potential partners listening to this conversation and thinking like, this is the type of technology we need, or we want to explore. How do they connect with you and your team at Sensi.AI online?
Yeah. So we're everywhere. We're on social networks. Our website is www.sensi.ai, where they can go and get all the content, all the explanation, how it works. Unfortunately, right now we're focusing on home care agencies. So if they are getting any kind of physical care, they should go to the home care agency and say, I want peace of mind. I want 24/7 safety net. I want you to
Yeah.
work with Sensi, and obviously we'll be very open to
Right.
talk to them as well. But it's really easy to reach us. Me personally, my email is nevo@sensi.ai. So if someone wants to reach out, I'll be more than happy to provide any information or direct them to the right
Right on.
people.
Yeah. Nevo, it's been a pleasure connecting with you today and learning about what you guys are building at Sensi.AI. You and I were talking even before the podcast. This is a decision point that a lot of seniors that will be retiring and making this decision of like, do I go down the home care route? Do I go to your traditional like senior assisted living community? Like they will have to make that decision, including folks like my father that's, getting to the age of like being eligible for Medicare. But like you said earlier, that doesn't cover everything. So you need to still make the decision, whether it's yourself or as a family, like what path do I go down with my mom, dad, like grandpa, grandma, etc. Right. So I think this is a decision that a lot of Americans and like our elderly population will be making, and the decision, will have to be informed by, like you said, what agencies out there are using the right blend of services, technology. Like that's what I think we're all getting better we're becoming better consumers of like AI and technology, where that's going to become part of your like evaluation almost in a few years from now. So really excited to see how things take off for you guys and the market at large. And we'll definitely be keeping tabs on the work you guys are doing. And thanks for being a great guest on the podcast today.
Podcast.
Thanks,
Thank you
Nevo.
so much for
Appreciate
having
it.
me.